the home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
countries across the globe have been hit by the COVID-19 virus.
Views,
there's a global trend to see an increase in GBV incidences, specifically domestic violence.
Sports,
What's he say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuga Online, your inspiration radio station.
Hi there, and welcome to Healthcare Hour with Colleen Qvist. How's everything going? I hope that you are having an amazing week, that you're keeping warm or not warm, depending on where you live, because I'm sure if you're in the Northern Hemisphere, I know that you are having quite good weather at the moment. As you know, I am a coach. I work with healthcare professionals. I work with professionals of all backgrounds on the other side of their title, because often titles get in the way. As you know, also, healthcare professionals are people. It's also about us understanding how to improve the relationship between the healthcare professional and the patient. And of course, as patients, at any point we go from public to patient, we need to be informed. We need to take active decisions and understand that there are consequences for our choices in our own health. My guest today is Henning Gericke. He is a counselor. And hi, Henning, welcome.
Hi, Colleen. Thanks for inviting me.
Thank you very much. So let's pop out for a break so that I don't get into trouble when we don't put in our sponsors. So we'll have a break, and when we come back, we're going to hear more about you, Henning, more about your career. But we'll go for a break first.
The Africa Center for Work-Based Learning is a professional development center for professionals who aim to improve their professional standing. This means that the learning programs we run are more than just academic programs. They are work-based programs that focus on leveraging your current experience as a professional to build your overall profile. A year down the line, the Africa Center for Work-Based Learning is developing into a preferred center for professional development in Pretoria, with 8 professional development faculties including accounting, teaching, entrepreneurship, as well as IT and many more. For more information, go to acwbl.org or dial +27 12 751 7608. The Africa Center for Work-Based Learning, where work is learning.
Hi there, welcome. You are listening to Healthcare Hour with Colleen Qvist. My guest today is Henning Gericke. He is a counselor and he works with professionals, all different people, but has a special interest in healthcare professionals. But first, Henning, tell us about you. Why did you choose counseling? How did you choose counseling? What is counseling?
Thanks, Colleen. Look, I think some people make quite a deal about the differences between counseling and coaching and therapy. Personally, I don't see it in such distinct ways. I know for purposes of registration with professional bodies, they do place a big emphasis on some of the differences. But for me, it's all about conversations that you have with people. You obviously have a specific purpose in mind. There's a specific goal to it. And depending on the modality that you follow, you will structure your conversation in a different way. But for me, it's about getting the change that a client wants, right? So clients do come with a specific purpose to therapy. They often come with a goal, but in the process, I also help them to get behind that goal and looking at the outcome of the goal, right? So many of them will come into counseling having a specific goal in mind, but what we actually after, I almost want to say probably always, is the outcome of that goal, right? So if someone says, okay, I want to win the lotto, I want to win R1 million, whatever the case may be, it's not actually about the money, right? I mean, what are you going to do? Sit with the money in your house and then do what with it, right? It's about what you can do with that money. It's about, okay, so the goal might be I want to win that R1 million, but what you actually want is what you can do with that R1 million, right? So also then to help clients to get behind the outcomes of their goals, and then to get them to develop into the best version of themselves. That's the way I see my task in counseling. But obviously that is from my perspective and my modality that I work from. Other people will most probably have a different view on that. In terms of my background, so I did a Bachelor in Science with psychology and physiology as my main core subjects in my final year. Then I continued with honors in psychology, and then I actually did a post-graduate diploma in education. And I actually started my career as a counselor in a school. And I did that actually primarily for 15 years. But people seldom realize actually the experience that you get within a school environment, because it is actually just a slice of the broader community, right? So, I mean, you see all kinds of different things there, and you don't only work with the children, right? You work with your colleagues, you work with the parents, you work with other professionals. So, I mean, even looking back today where I'm now, I'm very thankful for the experience I gained there, because I think probably, you know, it's one of the most or the broadest experience that I possibly could have had. Just to give you some idea, I think there are many doctors, if some doctors are obviously listening to this recording of today, who maybe have never seen what they call psychogenic non-epileptic seizure in their lives. They've treated the patient after they heard about the occurrence. They've maybe read about it, they've seen it on a recording, but within the school environment, that is something that I've witnessed, which is actually a very rare thing to witness. So yeah, a very broad experience base that I gained. But even while I was in this primary role, I also got some exposure to trauma therapy through some of the employment assistance programs for companies, where I did on-site trauma counseling. Was also involved with Stellenbosch University's what they called a community clinic, basically, which they used as part of the training for their master's degree students. But because they wanted to make it a more functional working clinic throughout the year, not only limited to sort of the academic calendar, they also involved other people. So I also became involved there.
Yes, so I can hear that what people don't often understand is that coaching, psychology, counseling, they've all evolved.
Absolutely.
And so that whole idea of, psychology and therapy often get the rap of, okay, let's just talk about, let's just talk about. Whereas I can hear that you are action-based. What is the outcome that you're wanting? Not to just spend the next 20 years talking about.
Exactly. Well, look, even if a client comes in and says that he or she wants to talk about something, or I want to understand myself better, the question is still, okay, and if somehow we can manage to do that, what would you like to gain from that? If you can do that, what difference would it make in your life? It's still a means to an end, and people don't always see that or understand that.
Yeah. Okay, so you're also very evidence-based and obviously involved in research.
Actually, not formal research. No, I'm way more
research.
I'm way more pragmatic. Very hands-on. So yes, I did. I guess you can call it a bit of informal research when I presented a course in 2023 to medical students at Stellenbosch University, where I measured the outcomes of the intervention that I provided as an external service provider to the Tygerberg students at Stellenbosch University. And I keep very much up to date with the latest research. I'm also, so my predominant modality is that of solution-focused therapy. And I'm very much involved in the solution-focused universe, it's called nowadays, which is the biggest training institution for solution-focused in the world, formerly known as the Solution-Focused University, based in America, but with lots of international participants and students. So I've been involved with them since 2016, when they originated. So I'm also very much involved in that and very much knowledgeable on the latest research. But I myself, I'm not a researcher.
No. Okay. So we're not going to have all the actual real researchers after your blood, saying, how dare he identify as a researcher?
No, I don't.
No, but it's also important, though, that we bring in research. We bring in other
Absolutely.
people's research. It's not just like you've woken up one day and gone, yes, I think we'll, yeah.
No,
we've got people's lives at risk here.
No, absolutely not. I mean, look, evidence-based practice, of course, is crucial. And that's why you have to keep in touch with the latest research, although you're not doing research yourself.
Yes.
So, yeah, that is, to me, a crucial part of my practice.
Yeah. Yeah, and also a friend of mine who is in research also says, if we just document the day-to-day, that in itself is research. It's lived experience of what you,
Absolutely.
And not to downplay that, just because we didn't do a double-blind randomized control trial or whatever, that it's not research. It doesn't, it still informs going forward.
Absolutely. Yeah. Yeah, nowadays they also write, so maybe still in some circles, but formerly also placed a very big emphasis on evidence-based practice. And now they also speak about practice-based evidence, right?
Yes.
So it goes both ways.
Yeah. Okay. All right. So let's go for a break. When we come back, we're going to hear about healthcare professionals and what it is and what they're experiencing. And, we hear a lot of advocacy, but I'm starting to say, okay, where is the outcome? Where are the results? But
Yes.
Let's go for a break.
The home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
Countries across the globe have been hit by the COVID-19 virus.
views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What's he say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuga Online, your inspiration radio station.
Welcome back. You are listening to Healthcare Hour with Colleen Qvist. My guest today is Henning Gericke. He is a counselor. He works very much as a solution-focused therapy. Gone are the days where we just go round and round and round. Let's talk about what happened to you. It's about asking his clients what outcome they want, what is the result of therapy that they're wanting. Yes, so Henning, talk to us about your role in healthcare with healthcare professionals.
Yeah, sure. So I wouldn't say, I guess it started for me there, but I think one could say I had a renewed interest in the mental health of healthcare professionals during the pandemic. So obviously we all know during the pandemic, the online modality became quite popular because we had to communicate in that way, and seminars which used to be in person then became online seminars, etc. So I actually made use of that opportunity, and I actually I actually attended quite a couple of webinars on mental health, and then specifically for medical professionals, but presented from different countries. So I attended quite a couple from the UK as well as USA, and then in South Africa as well. So, you know, I think there were obviously some unique challenges throughout the pandemic for medical professionals, but it also just brought to the fore some of the issues which have always been there, right? But it just were accentuated within this time, you know, such as burnout and moral injury and trauma and all those kinds of things. So I became involved in the healthcare worker care network, a mouthful. But that's basically caring for the carers by the carers, right? So they got together, it was a psychiatrist, unfortunately I can't remember her name now, from Gauteng, who got together psychiatrists, GPs, social workers, counselors, and psychologists to form this network to then provide a service for the people on the front line, as we called it, especially during the pandemic, right? And most of it was done online, although also occasionally where possible, people went in to do it in person. But yeah, that's where I really developed this renewed interest in medical professionals. And one also started to see a shift during that time, especially maybe rather towards the end of the pandemic and post-pandemic, where medical professionals, they became tired of the old way of presenting any kind of intervention, which was very much focused on sort of standalone interventions outside of your everyday work, right? So things like mindfulness exercises, massages, things like
The fruit platter on Fridays.
yes, exactly, meditation, etc. And there's
Yeah.
obviously nothing wrong with that, and it definitely has its place. Don't get me wrong, but you know, to have this one-size-fits-all approach specifically to medical professionals, where you give this typical generic advice like in, you know, eat healthy, take breaks, and they're just going to
Get your
tell you,
sleep.
but yeah, exactly, get more sleep.
Yes.
So where on earth am I going to do that if I have a 12-hour, 14-hour,
Yes.
20-hour shift?
Yes.
I can't even go to the toilet. How on earth am I going
Yeah.
to get more sleep, eat more healthy? My hospital only has a vending machine. So, you know, don't come and tell me these nonsense. You know,
Yeah.
so there came this resistance, and I saw this resistance in medical professionals. And once again, because I attended these webinars worldwide, I also discovered it's not only a South African phenomenon, but specifically then, yeah, so it was basically limited to South Africa, UK, and USA. But in these three countries, you had very similar patterns that started to develop. And because I have an interest in positive psychology, where we focus more on your resources, your strengths, rather than focusing on specific diagnoses and problems and psychopathology, you know, I started thinking, but what can I do from my kind of approach to maybe address some of these issues? And, you know, then I started to develop a course specifically for medical students, because at that time, I also worked as an external service provider for Stellenbosch University. I think I mentioned that before. But I used that opportunity then to launch this intervention. You know, where I worked from, as I said, this positive psychology approach, but where we targeted emotional thriving and emotional recovery. And the reason, or part of the reason for that, is if you look at burnout, some of the core elements of burnout, according to the Maslach inventory, burnout inventory, which is one of the most well-known and most used inventories to measure burnout, they look at personal accomplishments, emotional exhaustion, and depersonalization. But if you look at the positive side of those issues, then the thinking is, the reasoning behind it is, okay, so if somehow we can improve your emotional thriving and recovery, we're going to counteract burnout. And I think at least within my small sample, it definitely showed to be correct. At the same time, so I actually started this just because it's my approach. I really believed in it. And on an individual basis, through my work at the Health Worker Care Network with people on the front lines, I saw the successes. And I just believed, well, if I can do it for individuals, I'm sure I can do it for a group as well. But I didn't really have, we spoke about the evidence-based a bit earlier.
Yeah.
And then fortunately, I read on LinkedIn some of the research of a person in the USA, and his work that he has done on the use of positive psychology principles. It's a Brian Sexton, and he had quite extensive research, which definitely showed at least that positive psychology as a foundation, and some of these principles as a foundation to these interventions, are very effective. So he had especially two big research articles in 2020 and 2022. And although I don't know the exact content of the course, I know that mine was actually designed on the same principles, at least. So that also gave me some more confidence to go ahead with this and to look at some of the results. Yeah, I don't want, do you want me
Yeah,
maybe
I think
to
we can
give
leave it there.
some of the results? You want
Yes.
to ask me something
Okay.
else?
So, yeah, after the break, we'll dig more into that. But let's go for a break.
How do you know the life of personal coach you're about to work with is who they say they are? How do you know if they can do the job? At the Africa Board for Coaching, Consulting and Coaching Psychology, we can tell you. So, before you share your secrets and spend your money, check with us first. Visit www.abccccp.com or call us on 012-751-7608. The ABCCP, the professional body for coaches.
Welcome back. You are listening to Healthcare Hour with Colleen Qvist. My guest today is Henning Gericke, and he's talking to us about how he got interested in the mental health of healthcare professionals. He has pointed out that the pandemic added to the issues. There were already issues before the pandemic. And also we tend to try and fix things with the plaster of, here's your fruit platter, here's your get more sleep, eat healthier, but it's not taking into account the environment that the healthcare professional works in. Okay, so you've put together a program which obviously takes into account the reality. I think we've also got to be careful about saying that it's just endless. We know that a person's resilience isn't endless. So it is about us looking at the environment to see how do we change the environment, and that the responsibility is not always on the healthcare professional to, oh, come on now, you need to be tougher.
Yeah. No, look, because before I maybe say something about the results, that's extremely important, right? Because I think at that time, we're talking about 2023 now, there's once again been some shifts, I think, in some of the needs of medical professionals and where they find themselves. Because I think there's been even more of a pushback against any kind of intervention, because interventions focus on individuals, and often the implication then is, okay, but then then you are the cause of the problem, and your resilience is just not strong enough, big enough. You're not doing enough. You're not good enough, and that certainly is not true. I think, especially in the South African context, in the government context, it is a reflection of the system. It's a failure of the system and not a failure of the individual.
Yes.
So I'm very much in conflict, especially nowadays, in terms of what I should be doing, because sometimes it feels to me that it's like a boxing match, and the person between rounds, I don't know what you call that person. Maybe sometimes it's the coach, maybe it's a first aid person. I don't know what you call that person, but propping up the boxer for the next round. So sometimes I really feel like, am I doing them a disservice maybe by just propping them up for the next round? So I work on an individual level, I get them again back to their baseline, but very possibly they're going to be in the same state in X number of months or years. So clearly, that is not sustainable, and that is not the only answer. But at the same time, I'm also asking myself, okay, so if we don't provide any services on an individual level, well, what impact is that going to have? So then they are just absolutely left alone within the service without any help. And that's also not the answer, right? So I guess the answer lies in both a systemic approach as well as an individual approach, but knowing that the individual approach definitely has its limitations. And, I think medical professionals should speak to people like us and tell us how we maybe can contribute to also increase pressure on the powers
change
to
the
be,
system.
to change the system. Absolutely.
So
I'm
I mean,
very much aware of that.
totally, yes, we're totally in agreement that the system, it's almost like where we keep on looking at the flower and saying the flower isn't growing, but we're not looking at the environment that the flower is growing in. But it's also, to your point, Henning, is that you don't want to say to the flower, oh, well, until your environment changes, there's nothing we can do. You are at least throwing this flower the lifeline of saying, let's help you cope better in the mess that you're in.
Yeah, that's a very good analogy. Very true. Yeah, and once again, interestingly enough, I mean, you see the same pattern in the UK and USA. And unfortunately, you see people in the UK also leaving the national health system, going private, and also even going into other areas of medicine, like so-called lifestyle medicine, because they actually now want to practice what they preach. They want to make themselves healthier and their patients, but they can't do it within the system. So both here and in the UK, I guess other places as well, but these two I'm more familiar with, are unfortunately leaving the profession either altogether or at least the government system. But to just quickly return to some of the outcomes of my intervention, so it was, just to be fully transparent, I mean, it was a small sample size. I think, if I remember correctly, about 12 students. So we had 3 groups of about, so I think some left before we ended the intervention, but we had about 12 students and 3 groups, divided into 3 groups, right? And 3 sessions of an hour each, where I then presented them with an experience, right? So it's taking them through a process where they can develop this emotional strength, thriving, and recovery. So it's not a psychoeducational session, because that's another problem that I get feedback from medical professionals is, they often have these educational sessions where you're sort of taught the theory, but now you have to go and put it in practice. And that's very
Yes.
hard if you spend all of your time, in any case, on your clinical skills and your patients, and you burned out in any case. So from a
Yeah.
burned out position, how are you going to do these things and implement these things? So
Yeah.
the idea was that these sessions were the intervention. It's not like now you still need to go out and do X, Y,
Now
Z.
you must still go and do homework.
Yes,
Yes.
absolutely. And people don't do it. We all, even if we're not burnt out, how many people
Mm.
do go and do their
Yeah.
homework
No,
that's given to
totally.
them by therapists, right?
Yeah.
So the experience was the intervention. And so I did a post-intervention survey again with a Maslach burnout inventory. And there was actually a substantial decline of 71% of people in disagreement with questionnaire statements related to emotional thriving. In other words, there are certain items within the survey that correlate with emotional thriving, and before the intervention, people reacted negatively to that. In other
Yes.
words, they
It's
said,
like
okay,
there's no ways I'm thriving at
yeah,
all
I'm not
compared to
thriving,
no,
right?
I am
Yeah.
thriving.
Yeah.
Yes.
So the difference then was that there was a 71% decline in those items, or people responding in a negative way to those items. And correspondingly, the agreement with these experiences increased by 37%, which was quite a significant shift. The other interesting thing, of course, is that you might not be emotionally exhausted, but yet you are not thriving. um, right. So those two things can sometimes be totally separate things. Right. So there was also this one participant which actually had quite a low exhaustion score of 17, for those who know the survey, who are familiar with the survey. She actually had the second lowest emotional exhaustion score of all participants, but yet she had a 17% increase on emotional thriving. Also just showing that those two don't necessarily go
Yeah.
hand in hand.
Not
Yeah,
like
so
if you're here, therefore you must be there. It's not
e-
like, yes.
exactly, yes. So yeah, and then there were, some benefits, huge benefits for some individuals as well. So, I mean, not by a long shot was this a formal research study, but I felt that I had to approach it in a bit more of a scientific way and do the actual measurements. Because, the other thing, and I think you've alluded to this a bit, is there are all these interventions left, right, and center, but does it actually make a difference?
Yeah.
Do we actually make the effort to measure it in any way? It doesn't have to be this big master's thesis, but that, can't we even give a questionnaire pre and post intervention? And it
Yes.
seems like
Yeah.
that even that is not happening. So I think at least I made a start. It had some positive indications, but since then, as I said, things also changed quite a bit. So I tried to take this from the field of medical students to practicing medical professionals. And to a limited extent, I was able to provide the same service to nurses. And then, sure, I can't remember exactly how long ago it was. Not the most recent issue with unemployment of
The
healthcare
one
workers,
before. Yes.
but the one just before that. So I had a similar intervention, but tweaked it a bit for unemployed medical professionals. But yeah, that opportunity was taken up to a very limited extent. And the unfortunate thing is that some people have now created from past experience this expectation that you're going to, as a medical professional, you're not just going to provide me with these quick fixes and things that are totally unrealistic. So if I now advertise a service, people have these pre-existing ideas and perceptions, which makes it very difficult to really try and get the opportunities out there and to try to get people to buy into it.
Yeah. I think you're touching on a very good point there, you know, before we close, of also saying that the intervention is out there, different kinds of interventions, but it's almost like the person doesn't know they need it or doesn't necessarily take it up until it's too late. And I mean, a doctor said to me, "Why weren't you in my hospital when I needed you?"
Mm-hmm.
And I said, "If I had been in your hospital, would you walk down the passage?" Yeah. And he said, "Well, no, but you should have been there." Yeah.
Yeah.
Yes. Okay, so in closing, Henning, what would you say your message is for the healthcare professional?
Sure. Well, I think it's looking after your own well-being before you can help others. It's such a cliche, but it still remains very, very true. I mean, as we said, it's not sustainable to work in a way where you're not going to look after your mental health. But in some ways, medical professionals also need to mobilize themselves, make use of people like us to try and help you to mobilize yourselves to change the system as well. So as we mentioned, it's not an either or thing. It is help on an individual level, but then also we have to do much more to try and change the system as well.
Yes. Yeah, so I was also seeing as well that, sometimes self-care seems very indulgent to call it self-care. But when you talk about caring for yourself as well as others, then it's also like, it's not just a me. There's not just a me in it. But if I don't look after me, there is no us. And there's no you. If I don't look after me.
Totally agree.
Okay, so thank you very much for joining us. This show goes by very quickly, as you can see. The time disappears on us. But thank you for coming to share with all of us. And I hope that people will take action and take ownership of their own mental health.
Thanks, Colleen. Much appreciated. Thanks for the opportunity.
Okay. So thank you for joining us. You've been listening to Healthcare Hour with Colleen Qvist. Please remember that you are loved, you matter, and you're not alone. I'll see you next week.
The home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
Countries across the globe have been hit by the COVID-19 virus.
Views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What's he say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuga Online, your inspiration radio station.